We have a simple message for all countries: test, test, test. Test every suspected case.
The Director General of the World Health Organization with that message. But the suspected cases might not be the biggest issue. A new study published in the journal Science is putting a hard figure behind the number of people who may be walking around with the virus unknowingly. Based on data from China, researchers found that undocumented infections were responsible for 79% of documented cases. To put it another way, scientists say for every known case, there are about 5 to 10 undetected cases. The study found that those with undocumented infections experience mild, limited, or no symptoms at all. That, of course, puts more people at risk because the illnesses go undetected. Joining us now, director of the Harvard Global Health Institute, Dr. Ashish Jha. He is a practicing physician, also professor of medicine at Harvard Medical School. Welcome back to the show. Great to have you back on. Doctor,
good morning.
Where do we stand right now? I mean, there are hospitals in New York City and major cities where the emergency rooms are not that separated in terms of people coming in and trying to get tests not being available, waiting in hallways. This has happened in the past week. This appears to be headed in a very bad direction.
Yeah. So, look, we're still way behind the curve in terms of where we need to be on testing. The good news is just in the last 12, 24 hours, I'm starting to see data, hearing from colleagues, that we're starting to get moving on testing. Again, we're way behind. I don't want to oversell this. We absolutely need a lot more tests. My sense is we're doing about 10,000 tests a day, maybe across the country. We probably should be doing 100 to 150,000 tests a day, maybe even more. So we have a long way to go, but just starting to see a little progress.
Dr. Jha, it's Willie Geist. Help us understand that, because the White House has told us that a million test kits have been sent out. There are 5 million on the way. Where are those, and why aren't they being used at the pace that you say we should be using them?
Yeah, so, look, we heard a couple of weeks ago from Vice President Pence that there were 1 million kits on the way. I don't know where they are. None of the health officials I'm talking to know where they are. What hospitals are starting to do is much more coming from their own labs, from private labs. So I think all of us are a little bit baffled by what the federal government is saying, and the progress is at the local level.
You said, I was reading you on Twitter before you came on, Dr. Jha, you're now calling for a national quarantine. Can you explain what exactly that would look like in this country?
Yeah, this is, look, I don't say this lightly, and I've been thinking about this for a couple of days, and when I'm watching the data, America, we're up to 4,500 cases. I think most experts I talk to, my own guess is that we probably have 30, 40,000 Americans infected right now, and it's growing exponentially. And our hospitals and emergency rooms are not ready. And so we have two choices. Basically, we can either have a national quarantine now, 2 weeks, get a grip on where things are, and then reassess, or we cannot wait another week, and when things look really terrible, be forced into it, and that's going to last much longer. Many more people will die. So those are really our two choices. Get ahead of it, or wait until we're even further behind. What it's going to look like is Italy. Essential services will stay open, groceries and pharmacies, but non-essential stuff, people have to stay at home, no public gatherings, certainly no bars, no restaurants. It's going to be really hard and economically very tough, but the alternative is economically even more devastating. So I think we're between a rock and a hard place. We got to make the right call.
We're looking at are we looking at emergency rooms and ICUs being filled beyond capacity, and the United States not being able to keep up?
Yeah, so we've been doing some analyses, and we're hoping to make them public later this afternoon when we get the numbers finalized. But basically, even under very rosy scenarios, if we do nothing, most hospitals in America will get overwhelmed. We'll have too many cases. They will not have enough beds or ICU beds. So every hospital executive this morning has to be canceling all elective cases, strategizing for how you keep COVID and non-COVID patients separated, and really thinking about how to expand capacity substantially. Look, if we overreact, we're going to waste some money. If we underreact, we're going to count our losses in lives and money. This is not, to me, this is not a close call. We got to get much more serious than we are.
So, Dr. Jha, it's Donny Deutsch. What's the data point that we wait for that there's a little light? What has to be said that all of us, because right now we're looking, are we shut down through August? Are we shut down? What would be the point that your community says, okay, we can start to get back to who we are?
Yeah, it's a great question. So we're like 2 steps away from even being able to make that decision, because right now, because we don't have tests, we don't know how many cases there are in America. We don't know where on the curve we are. Everybody's saying we're 2 weeks behind Italy. I don't know if we're 2 weeks behind Italy. We may be much closer to Italy because we're not testing adequately. So what I would like is for us to take a big pause, 2 weeks. During that time, ramp up testing. Get all the people who need to be tested. At that point, we'll have a much better grip on how extensive the infections are, which communities are really affected. We'll have time to strategize and plan. And then we can come back and say, how do we bend this curve? How do we get off of this? What is right now a tsunami in front of us? How do we get ahead of it? We need that national pause now. I don't see anybody being able to make predictions about, is it going to be May? Is it going to be August? Is it going to be all year? I think it's too early to tell because we don't even know where we are today.
Dr. Ashish Jha, thank you very much for coming back on the show. So let's turn to columnist for the New York.
Thank you.
Oh, no, we appreciate it. And actually, I think we're all kind of beginning to understand this and take it in, and it's day by day. And Dr. Jha, we really do need the science here. We need the reality check. And it's not pretty. Yeah. That is for sure. Yeah. So thank you.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.